Good morning. Buenos dias.
Bom dia.
Sou assessora regional para envelhecimento saudável da OPAS-OMS e é um prazer dar as boas-vindas a esta sessão sobre cidades.
It's a pleasure to give you the welcomes to the session for the cities and communities friendly to the elderly. It's a pleasure to be here with a delegation from the state of Paraná in Brazil and representatives from the AARP in the United States, our colleagues from PAHO and WHO and participants, and all of those who have joined us virtually. Eu gostaria
Rhonda Seeley Thomas, PAHO's Assistant Director, and invite her to share her welcoming remarks.
Thank you and good morning. Esteemed Governor Carlos Roberto Massa Jr., Ms. Leandra Del Ponte, Secretary for Women's Health, Racial Equality and Older Persons, Government of Paraná, other esteemed authorities from the state of Paraná, and I also want to recognize Mike Watson and Lynn Mertz from AARP, Dr. James Fitzgerald, the Department Director from our HSS department here at PAHO, Mr. Christian Morales, PWR from Brazil. Good morning and a very warm welcome again to PAHO. I would like to extend a warm welcome to all of you here today and also send a special greeting to our participants who are joining us virtually. Thank you for being here with us. It is both a pleasure and a privilege to welcome you to this meeting of the affiliate programs of the WHO Global Network for Age-Friendly Cities and Communities. I am especially pleased that PAHO can serve as a common ground where the programs of Brazil and the United States of America meet, share experiences, and identify concrete opportunities for cooperation, working together to create true age-friendly environments and to contribute meaningfully to achieving the goals of the United Nations Decade of Healthy Aging 2021 to 2030. As we reflect on the progress achieved in the first half of the decade and on the challenges that remain, this gathering is a timely opportunity to reaffirm the vital role that cities, communities, and leaders at every level play in shaping the experience of aging in our region. The Americas is undergoing one of the fastest and most unequal demographic transitions in the world. While Canada and the United States experienced population aging over several decades, many countries in Latin America and the Caribbean face this transition in a shorter period of time and often amid persistent social and economic inequality. In this context, the environments in which people live become even more critical. Age-friendly cities and communities are the foundation of resilient, inclusive, and sustainable societies. They help to close the gap between life expectancy and healthy life expectancy, strengthen social cohesion, and promote rights, dignity, and health across generations. The WHO Global Network for Age-Friendly Citizens and Communities is a key instrument to advance this vision. In just over 2 decades, it has grown to more than 1,700 cities and communities worldwide, over half of them in our region. This progress reflects the leadership of governments at all levels, the dedication of local champions, and the advocacy of civil society leaders who understand that age-friendly environments are essential for economic resilience, social cohesion, and human dignity. PAHO is proud to have supported this process, providing technical assistance, policy guidance, and platforms for peer learning to help translate the network's vision into practical, context-specific solutions. Within this network, affiliate programs have emerged as powerful engines of change, driving innovation and adaptation to local realities. The United States and Brazil, two vast, diverse federal countries, share common challenges in responding to aging populations, varied territories, complex governance, and the need to coordinate across multiple levels of government. Yet, these challenges also create unique opportunities for learning and collaboration. In the United States, AARP has led one of the world's largest and most impactful age-friendly initiatives since 2012. With more than 380 participating cities and communities in the WHO Global Network, it has mobilized broad partnerships to create inclusive, livable communities where people can thrive at every stage of life. In Brazil, we proudly welcome the state of Paraná as the newest affiliate member in the region and the first in the country. Paraná has demonstrated outstanding leadership by institutionalizing the age-friendly agenda across sectors, engaging 38 municipalities and ensuring strong commitment at the state level. By strengthening the bridge between AARP and Paraná and fostering dialogue among all affiliate programs in the region, we can accelerate the adoption of effective practices, encourage innovation, and expand the reach of the global network across the Americas. This is where cooperation becomes transformational, when we not only share successes, but also address challenges together. The Decade of Healthy Aging gives us the mandate and framework for this work. It reminds us that fostering the abilities of older people requires cross-sector collaboration, meaningful participation of older persons themselves, and sustained commitment from local to national levels. Let us seize this moment to reaffirm our shared vision and deepen our partnerships. Together, we can ensure that every community, urban, rural, large or small, becomes a place where people of all ages, and especially older persons, can live, participate, and flourish. On behalf of PAHO, I thank you for being part of this important journey and welcome you to a meeting of exchange, learning, and building the foundations for stronger collaboration in the years ahead. Thank you for your kind attention.
Thank you very much, Dr. Celie Thomas, for highlighting the critical role of affiliate programs in the Americas and the opportunities that age-friendly cities environments bring to achieving the decade of healthy aging. Before we continue the program, I just would like to mention that we do have translation available. So we do have interpretation for Portuguese, English, and Spanish for those connected online and for those in the room here. So you can use the headphones and pick the language of your preference. Now, continuing with the program, I would like to invite Dr. James Fitzgerald, Director of Health Systems and Services at PAHO, to present on age-friendly cities and communities, a key strategy for the United Nations Decade of Healthy Aging.
Thank you very much, Patricia. Muito obrigado, Governador, Secretário da Mulher, da Saúde, Ciro, da Missão, Comitiva. I'd also like to recognize the presence of the AARP and, of course, our colleagues from Montgomery County, here from HHS in Maryland. And, of course, our AD and PWR, as well as our ex-PWR, Socorro, who is also in the room. And the technical team that have been working in this area, including Tiago de So, who's connected from WHO in Geneva. So it's really a pleasure to be able to present to you this morning a brief presentation on the status of the initiative, the WHO initiative on age-friendly cities and communities. That's really a key strategy, a part of the UN Decade of Healthy Aging. As we begin to look forward to 2030, a key moment as part of the SDGs, we heard from Dr. Barbosa this morning, and indeed the Governor of Paraná, talking about how the demographic transition. Next slide, please. The demographic transition within the region of the Americas has been critical as part of the challenges that our health systems, our social care systems are facing within the region of the Americas. Just go back one slide, because I really do want to recognize, especially for those from Paraná who have worked closely with Enrique Vega in the development of the agreements and legal frameworks that you worked with Enrique. Unfortunately, as you know, Enrique is no longer with us. But I'm sure he's very much here in spirit in the room and with you as you engage on this wonderful journey in Paraná. Next slide, please. You heard from the director this morning about talking about the demographic transition and how the demographic transition in the region of the Americas is occurring within a very short period compared to more established either European, North American countries. We've seen a rapid aging of the population in the Americas, and unfortunately, the infrastructure, the policies, the frameworks, the care systems that are required are not in place as of yet to be able to deal with this. We see significant differences not only in life expectancy between men and women in our region, but when we look at the issue of healthy life expectancy, we see that the difference is even greater, particularly for women that are living longer, but unfortunately having to live with lack of functional capacities, or in fact discapacities, and in conditions of high vulnerability. And this trend will continue within the Americas, meaning that countries are beginning to look and work amongst each other and work with organizations such as PAHO and the Inter-American Development Bank to look at what structures and mechanisms and investments are going to be required to address the needs of older persons and to ensure healthy aging. Next slide, please. It's within this context also that the United Nations General Assembly adopted the Decade of Healthy Aging that really has 4 critical components to it. To first of all, for us to begin to change how we think, where we begin to look at older persons and the process of aging, not as a challenge, but also as a key opportunity to engage older persons in policy development, in the organization of care systems within their local communities. And to begin to look at the necessary intersectoral collaboration that is required to ensure support both within the home and also within the services and structures within the community. And to ensure, secondly, that the communities foster those abilities of older people, to ensure that right to work, their right to health, the community participation, the engagement, and the connectiveness that is so required at that community level to foster healthy aging. The issue of access to care is obviously critical. Here we're talking about access to healthcare, but also social protection, home care, other care needs that are required for older persons. It was last year, actually, within the context of longer-term care, that the Pan American Health Organization and its member states adopted a policy document and resolution specifically on the issue of long-term care. As many countries, including ministers of finance, are coming to the organization asking, what do we need to do to put in our budgets? What allocations do we need within our budgetary process to begin to address the rapid demographic transition and the increased requirements, particularly in the area of long-term care moving forward? And these countries range from upper income countries to lower income countries, each of which have very different economic contexts. And obviously then the delivery in the organization and the structures and the processes that are required to deliver integrated care for older people. So the Decade of Healthy Aging, next slide please, has certain reporting requirements. The first set of reports have been produced in 2022. We do have reporting requirements in 2026 and 2029. That will move forward. And we see some positive, I think, movement in some of the major indicators that are included in the reporting process. WHO obviously has a certain responsibility within this reporting area, and we see particularly in the development of the Age-Friendly Cities Initiative an increase in the level of change of this indicator in the order of 25%. And when we look globally and compare that then to the region, the Americas, we see that the Americas is really leading the way. And I think this, Governor, as we heard you talk this morning, is a testimony also to Paraná and how Paraná is also leading within Brazil, whereby we see there's comparative to the global indicator, which is 25%, we see a movement in the order of 33% in the region of the Americas. And so the Americas is really adopting the Decade of Healthy Aging, and within that, this initiative, very important WHO initiative around age-friendly cities as the demographic transition continues within the Americas. Next slide, please. Obviously, this is an intersectoral initiative, and it requires the engagement and actions across multiple sectors, and including the engagement of the community and older persons themselves. The overall objective here is not just to ensure specific care services, but to ensure functional capacity is maintained, and to ensure the environment around which those functional capacities can be supportive are developed in a manner that really supports the capacities of older persons, and so that they can live and thrive within their individual communities. And so the intersectoral component is really extremely important, whether it's between health and transportation, or housing, or education, or the environment. That those structures and mechanisms that are required to ensure this need to be established and put in place. And as such, I think the policies that we've also seen in the United States that have been supported either in Montgomery County or through the AARP, or indeed in Paraná, where this multi-sectoral approach is required, with the engagement of municipalities is essentially critical to the support and to the overall implementation of the initiative. Next slide, please. As part of this, we have the WHO Global Network for Age-Friendly Cities and Communities, and this really predates, I suppose, the UN General Assembly commitments established in 2007. We see that there are over 1,700 members across 57 countries, and you can see that there are different colors being used here. Where we see the darker blue countries are basically the national affiliate programs, and those countries that are striped, next slide please, that have sub-regional affiliations and programs in operation. And here we highlight Paraná, for example, that is extremely engaged. We heard the governor this morning talking about how 38 municipalities and cities are now engaged in this process across Paraná, moving towards 51 in the near future, and constituting over 75% of municipalities and cities in Brazil. Whereas in the United States, that number is tenfold. It's 380 within the United States, according to the latest figures we have. And so what we really seek to do is to replicate this experience, the level of engagement across the Americas, to ensure that countries begin to look at this as an opportunity, not just from the policy perspective, but the operational implementation at the local community level, to ensure that we have age-friendly cities and communities. Next slide, please. And so here we see the growth in the region. We have, I think, 18 countries engaged. We have some way to go. And so please continue to advocate with other countries in your work with them. We are certainly doing the same. Within those 18 countries, we have 1,000 cities and 8 affiliate programs that are working hard. But you can see that the Americas is really leading the way here. And so there are some challenges ahead of us in terms of making sure that this is really fully a mainstreamed program within the Americas, and so that we can learn off those countries such as Chile, such as the United States, such as states as Paraná, and begin to replicate and expand implementation of the Age-Friendly Cities Initiative right throughout the Americas. Next slide, please. Affiliate program is unique, and this is something that we really wanted to highlight. Just as every health system is unique, structured, organizational wise, financing, the methods and processes by which the affiliate programs are structured are also unique and very much adapted to the context of each municipality, city, state, national level. And so basically within the work that we do as an organization to support the affiliate programs, to support the municipalities, our standardized process of assessments, of looking at the current status of the municipality or the actual city, to facilitate that organization of intersectoral collaboration across the multiple sectors that need to be engaged to ensure that we have age-friendly cities, and to bring experiences across then regions, municipalities, cities, affiliate programs, so that one can learn from each other. But essentially, it's a global regional community that we're trying to develop here, so that you, as members of this affiliate program, of this initiative, can learn from one and each other and really move forward in bringing the necessary environment that is required for healthy aging for older persons. Next slide, please. We have certain resources available for you. They are here. Of course, we operate a network of support also, not just with those affiliate programs that are here present in the room, but across the region of the Americas, and of course with our development partners, including the Inter-American Development Bank, which is a very critical and key partner in this initiative, and I know is actually also very active in the state of Paraná within this initiative. Next slide, please. So that is really the overview that I wanted to give for you here today. You can count on our support. We have Patricia and Sonia and the team, and of course the team in Brazil with Christina and Christian, and of course our other affiliate programs to work and support you in your endeavors. But this is really something that is very critical, as you heard our director talking about, as a priority of the organization, so that we can rapidly address the challenges that are going to be facing a certain portion, a very and growing portion of the population in the Americas moving forward. Thank you very much.
Thank you, Dr. Fitzgerald, for providing us with an overview of the WHO Global Network of Age-Friendly Cities and Communities in the region, as well as the role of the affiliate members play in advancing the healthy aging agenda. I'll switch to Portuguese now. Quero agora passar a palavra para a secretária da Mulher,
Now I
Igualdade.
give the floor to the Secretary of Women, Racial Equality, and older people for the government of Paraná, who is being essential for other initiatives for aging people and other initiatives in the state. Good morning to everyone. I would like to thank for the opportunity to be here at the PAHO headquarters in Washington, D.C., together with our governor and all of our team from the state of Paraná, because in the state, when we talk about healthcare, Paraná is a national reference, and I'm very proud to also become an international benchmark. As we have said before, longevity is something we conquer as humankind, but it will only be successful if people have the chance to age with quality, dignity, and respect. And this leads our state as the state in Brazil that has the largest governments in Brazil to promote aging policies for the 399 municipalities for co-financing. And we are the only state in Brazil where all the municipalities have financing that allow us to get as close as possible to people where they live. And now the state of Paraná has become the first state in Brazil to have a state policy with state legislation that has come up with a care system. And this law is called Paraná Friend of Aging People, has three pillars. First is care. Second is to care and strengthen families. And third is to care for cities and prepare the cities so that they can be a good environment for people as they grow older. And with that, we have a system of care that will prepare our state for the future. We have an institute for research that shows that we'll have more people who are over 60 with those that are below the age of 14. It's a privilege for the state of Paraná, but it's a challenge to public policy because all the systems for healthcare and social care, they must not collapse. And we have to provide quality of life and happy life for everyone. So when we come up with the state policy for care to the aging people, we are thinking of taking care of everyone, but especially promoting autonomy, independence, and healthcare long-term so that those can have a healthy life in the course of life. And also, we need to provide care for the elderly and for the aging people so that we are aware of all of those programs in the municipalities to help the older people with a registry of the caregivers in Paraná, so that there is visibility to all the people who are caregivers, which is a very important job, but it's not recognized professionally in our country. We need to care for those who need, but also give the right amount of consideration for the caregivers. So we are hoping that the older people don't have to be sent to institutions because they will benefit from being with families and community. Unfortunately, in our country, most people are sent to institutions because many times the families do not have the means to take care of older people, but unfortunately, they have to continue to work because otherwise they will not have the money to take care of the family. So the government has an incentive for women who mostly are those who are the caregivers, which is to have a kind of stipend for the women so that the woman who is not being able to work any longer because she's taking care of the dad or her mom has to be recognized as such by receiving an allowance so that we avoid the collapse of the public system. And we talk about preparing the families, the cities also. I would like to say a word to PAHO and OMS to thank both organizations for the support that started with Dr. Henrique Vegas since 2015, when we started in the state of Paraná with the third city in Brazil, and also thank Dr. Ide Padilha, who was in the Brazilian government, and she supported us right from the beginning when our governor was with us, and Doutora Supor Gross, who we are seeing here, and also like to thank Dr. Socorro for her support, but above all, I'd like to thank Dr. Moraes, who gave us this opportunity to become an affiliate member due to the knowledge, the history, and determination within PAHO to work with this global trend that is the aging of the population, and helped us become an affiliate member here in PAHO. And we talk about preparing the cities. We would like to make use of this methodology that has been so innovative since 2005. And as far as we're concerned, is the best methodology to help older people, which is the friendly cities, the age-friendly cities and communities. And with that, we consider the community as a whole, creating innovative equipment, such as the social complex of age-friendly city. We have a pilot in one of the cities, and we have 5 equipment that have been built and are being implemented. And now we have resources in the amount of 150 million reais so that we can increase policies for older people regarding investments. So we will build another 10 complexes that is age-friendly city, which will be like a building where older people can spend the day and do whatever they enjoy. And this will be a support for the family who needs to work, because the person will have a place to go during the day and be independent, and will promote the participation of the elderly, which will avoid depression, solitude, and above all, dementia. So for all the set of policies, we have had the technical cooperation of the Inter-American Development Bank that has been contributing with $600,000 from Japan and France, where beyond all the components we already have, we will have an investment plan. And once we have the network, the knowledge of everything that the state have, the registry of the caregivers, knowing who are these people, we have to have people who are the caregivers, and we like that will be able to have an investment plan that will go beyond the first 150 million reais that have been investment, and like that will prepare Paraná for this future where people will live longer and they live with dignity, respect, and health quality, and where women will be the protagonist of the history, and the state government will value the woman for the private initiative and also to care and see her service.
Our goal, and we'll close now, it's a small goal. We want that the 399 cities of Paraná become age-friendly cities. And that's why we came here today with the governor to invite all of you and all the authorities of PAHO and WHO to help us face this challenge. It's a big challenge, but it's possible, because the first thing to do so that the elderly come to, be recognized as what they deserve is a political action. Our governor has shown that already. First thing is we had to take care of the elderly, and that started in the first day after he took office, when he created this opportunity for us to work and to establish a big policy, creating a special state secretariat for that purpose. Since 2024, this type of care for the elderly became a right. It's not just a social attitude. So I had the honor to be the author of this project that created for the country the national policy for care of the elderly. And now with the governor, I am honored to continue serving our state and preparing Paraná for the future. Thank you very much.
Muito obrigada.
Thank you very much, Secretary Leandro, for your kind words and also for your commitment with this subject. And to continue, I would like now to announce a panel that will show the different strategies of the affiliated program and the members of the global network of age-friendly cities. Carlos Roberto Massa Jr., Governor of Paraná, Brazil, Ms. Lynn Wirtz, and Mr. Mike Watson of the Livable Communities Program of AARP in the United States, and also representatives of Montgomery County. Montgomery County is a member of Friendly Cities, Jim British and Patrice Mackey. So I would like to invite Governor Carlos Roberto Massa Jr. to present the program Paraná Friend of the Aging People, and he'll show you the program and the strategies of the program.
Muito obrigado, doutora Patrícia,
Thank you
cumprimentando a
very
doutora
much,
Ronda.
Dr. Patricia. I would like to greet all the members participating to this meeting. And I would like now that I have the floor to show you a video which will show you what we do in Paraná.
Brazil is aging. It is estimated that in 2029 there will be more older than younger citizens in its population. The way in which elderly people are treated says a lot about who we actually are. Aging is not just a demographic data, but a right to dignity. Despite its robust senior citizen statute, which formalizes fundamental rights, Brazil features a shortfall of public policies that make these rights a reality, in particular for the more disenfranchised and vulnerable. But in Paraná, state in the south region of its territory, Brazil is finding examples that are becoming references for the entire country. 38 of the 51 Brazilian cities recognized as Friends of the Elderly by WHO are located in Paraná, taking on a role of protagonist in Latin America and national leader. Thanks to the state government's program Paraná Friend of the Elderly, investing in a network of housing programs with gated communities exclusive for senior citizens with adapted houses. Strengthening of a social protection network that features caregiver qualification in partnership with the Inter-American Development Bank. In urban mobility, through support for accessibility actions, free fare, and discounts in intermunicipal transportation, valuing the independence and autonomy of senior citizens through programs in healthcare, leisure, and social participation. Time passes, leaving its marks on our skins, wrinkles that tell stories, hands that carry memories. On this journey, time passes for everyone. The difference lies on how here we choose to care for each other along the way. Paraná, land of people who work and care.
Muito obrigado.
Thank you. Thank you very much. We are really very proud and very happy to be here today, participate at this meeting, this plenary meeting, and also to learn a lot with all that the Pan American Health Organization has been accomplishing with other Latin American countries. Paraná, like other states in Brazil, is facing this challenge to have public policies turned towards the elderly. It has been said several times here that Europe became rich before becoming old. South America did not have that privilege. We're now trying to improve quality of life. We're trying to enrich in a certain way our countries, but our aging is happening quicker and quicker. So one of the challenges in Brazil is to establish public policies for the elderly, but that is not happening as fast as it needs to. Brazil is a continent-sized country. Paraná is one of the Brazilian states. And because it's so vast, Brazil has states that are the size of some countries. For instance, Paraná is larger than Portugal in number of inhabitants. Our GDP is larger than Paraguay, Bolivia, another country, all together. So that creates challenges for each of our states to establish these policies. Now, the good thing is that Paraná has been able to not only dealing with life quality for the elderly, we have an average age of 79 years of age, a little above, beyond the national average, which shows that Paraná has created a good situation, good life quality, but a life, but it's also a challenge. How are we going to policies as it's been said in 2030, we'll have more elderly than people younger than 15 in Paraná. So that forces us to very quickly establish political policies to take care of the elderly. In terms of psychology, for instance, there is a challenge in terms of mental health. Many elderly uh, have a hard time due to depression or solitude. And this, of course, worries us. And we try to put that on our radar, using the state secretary to create a better situation for mental health of the elderly. And also some physical challenges, good sidewalks so they can walk in safety, and the public health network more accessible, better, and ready to take care of the elderly, and also spaces where the elderly can have a good place to spend the life, to carry out certain activities, be it cognitive activities or physical activities, so the elderly can every day more be moving around. And our country is an emerging country, so the situation is such that adults and teenagers need to work, work to have a minimum of income, ensure their good quality of life. So an adult has to take care of an elderly parent, for instance, does not have enough time in the day to be caring for the elderly parent all day long. So the public sector has to come into play here and create what is needed so that the children, the adult children, can work. And we have been trying to do, and the state secretary understood, we have 399 cities in our state. And in all those cities, we have created the consortiums where, together with the municipalities, we have implemented policies for healthcare, the elderly. And through these organizations, we are trying to include now the elderly in the plan. So working, and we are changing the public culture of municipalities and the way of thinking, the mentality of mayors who before did not look at the elderly this way in terms of needs of care. Because in Brazil, we concentrate on children first, bring them up, education, schools, etc., early, in the early age, and we had no policies for the elderly. So we're changing that now, changing that mindset with mayors, and also investing a lot of money to create healthier and healthier situations for the elderly, to providing means for the elderly to go out home to not too far there, and travel with other persons of the same age to get to know other things, and also housing. We have a very good housing program for the third age, and we aim at taking care, especially of the disenfranchised elderly, and to provide housing for them. And even those who could perhaps buy a house not get, of course, financing because the banks think that they don't have enough time to pay back. So we have a public policy to subsidize about half the value of the house for the elderly. And the simple fact that we're here today at PAHO, not only to be recognized for PAHO, but we are also here to have an opportunity to learn with the members of this meeting here today, so that we can inspire ourselves with what's done in other regions of Latin America, North America, and we could introduce new ideas in Paraná. And also to allow Paraná to inspire other Brazilian states in terms of better policies for the elderly. Thank you very much, and I thank you very much for the invitation.
Obrigado, doutor.
Muito obrigada.
Thank you very much, Governor. The goals are ambitious, promising, but we must say that all the results they have achieved are examples that should be shared with the whole region of the Americas. So I thank you.
To English now to invite our colleagues from AARP, Lynn Mertz and Mike Watson, to share how AARP, a non-governmental organization, was able to design and scale a national program, engaging local actors and becoming a global leader in the age-friendly movement.
Good morning, and thank you very much for the invitation to be able to come and to join you today. Our Vice President of International Relations, unfortunately, is out of the country now, and so he was unable to come, but sends his greetings. And I have the great fortune of newly joining the international team for age-friendly health. While I've been with AARP for a number of years, this is new, and so I look forward to being able to support and continue to work with you, Patricia. It's been wonderful to meet you. I want to welcome Governor Massa Jr. to the affiliate program, and we look forward to helping and working with you and learning from you also with everything that you are doing. I think a big focus within our global thought leadership team is really similar to what you have said a number of times, is how do we create more healthy years as we live? Because we are all aging, but how do we make sure that those are healthy, vibrant, contributing, and living the life that we want as we age? Without further ado, I want to defer to the rest of my team because they're the ones you really want to hear from what's going on. Mike Watson will kick us off as the director of the age-friendly programs, Livable Communities at AARP. Thank you.
Thank you, Lynn, and thank you, everybody. It's such a pleasure to be here. And like Lynn said, I'm going to try to be brief to pass you off to the people that you really want to hear from, the folks who are leading this work on the ground in a community just outside of DC in Montgomery County. But I'm Mike Watson. I'm the director of Livable Communities at AARP, and I have the pleasure of working every single day with staff and volunteers from our 53 state offices and roughly 1,000 communities across the country that are doing this work to become better places for older adults. I want to commend you for joining this network and being part of this global movement to make places better for older adults and people of all ages. So our network in the US is really designed around, as they know, we're a non-governmental actor, and it's really designed around a lot of what I've heard already this morning, and the importance of collaboration and partnership between government actors, non-governmental actors, academic institutions, and people. The important kind of thing that has been driving the age-friendly movement in the United States are regular people who are committed, who are activists. There are leaders in local government that we'll hear from in a bit. There are leaders at the nonprofit level, nationally, at the state level, and the local level. But truly, it is about empowering people and having folks who are interested in becoming an age-friendly community continue to raise their voice. So everything we do to support the network is really driven around that concept of empowering people who are on the ground. So we at AARP try to create structures and processes that are going to help people take action, but ultimately what we know is that this is that community's age-friendly action plan and the people who live within it. So we know that it's not AARP's action plan. What we want to do is create kind of programs and supports to make that easier. I'll talk a little bit about that, but first I want to talk a little bit about what the network is and what we see. As we'll hear from Montgomery County, about every single community within the network, which covers about 1/3 of people 50 plus in this country, takes an average of 21 actions to improve livability across those 8 domains that we've already heard from and seen. And we know that by empowering various stakeholders, there's lots of different folks who are leading. About 70% of age-friendly initiatives partner with the local government, but only about half are actually led by the local government. There are numbers that are led by nonprofit entities, again, and volunteers stepping up, health centers, and others. And we know that this leadership is coming from a variety of places, and it's leading to changes. About 80% of age-friendly communities in the US have been able to use that process to advance policy change and, importantly, deliver real benefits to people. So 90% of communities within our network report back that there are people who are benefiting from these tangible improvements every single day, with about 2/3 of those communities reporting back that over half of the population in their community is benefiting directly from age-friendly policies. And these are right along the realm of what we saw in the video: fare-free transit, new housing options, more accessible public parks, centralizing communication and information, and supporting family caregivers as well. I was really pleased to see and hear that. It's something that we see in the network across the US as well. So the ways that we've been able to support this are providing really kind of what we call turnkey structures for people to tap into. We have an online portal that about 75% of the communities within the network use. They can connect with each other to learn from each other. They can access and tap into resources. We share all of the previously approved action plans and progress reports, so folks can look into those, get inspired by what other communities are doing, maybe copy that, do it in their local government, and then reach out to the community who actually did it to get some information. And then we host a monthly webinar series where we bring in experts like folks from Montgomery County and other places to talk to the network about what they've done, all structured around a topic. And we've had about 1,000 participants in these webinars over the course of the previous year. So what we do is we try to provide these structures and enable communities to connect with each other and empower them to take action using those resources. And then, of course, we also provide technical assistance, grants through our ARP Community Challenge grant program, as well as publications, resources, and all other sorts of tools. So with that, I've talked a little bit about how we want to empower folks to connect with each other and learn from each other. And I'm really pleased to kick it over here to Sean to talk about the work in Montgomery County, which is one of the exemplar age-friendly communities in this country. They're kind of, I've read their action plan. We've always seen their results, and it's really impressive work. So I'm going to stop talking and kick it over to the folks who are doing this work on the ground now.
Thank you, Mike. It's really such an honor to be here. We appreciate AARP and PAHO. I'd like to make sure I introduce my supervisors, Dr. Patrice McGee and Dr. James Bridgers, who I'm so grateful that you came to participate in this conversation. It's really inspiring to hear what's happening in Brazil and Parana in particular. I'm interested when we talk later about some of the work about ageism, because so far we have not directly hit that. It's something that obviously it's undergirding a lot of the challenges that we all face, but I'm looking forward to hearing how you've addressed it. But just to make sure that people are aware, so yes, Montgomery County is right outside of Washington, D.C. We have about 1 million people, so far less than Parana. Highly educated, but also very diverse, like your community as well. People from all over the world. We have about 1/3 of our residents are foreign born. So we have a lot of diversity in terms of income and life experiences. As a requirement of the Older Americans Act, we do have an advisory council, and in Montgomery County, we call it the Commission on Aging. And this group has been incredibly active for decades in holding Montgomery County government accountable and to sort of increasing expectations among residents of what's available in terms of support for older residents. And, you know, if you said what was one of the ingredients of our age-friendly successes, I would say it's the continued pressure and involvement of advocates, volunteer residents in the county. So Montgomery County got a little bit of a head start on age-friendly because in 2007, our, at that time, newly elected county executive started something called a senior sub-cabinet. And so what he did was required department directors from around county government to gather on a regular basis and start planning for our future of the aging population. And so the strategic planning process that included multiple departments and did invite some businesses and nonprofits as well started way back in 2007. So actually, the notion of age-friendly, when it came along, some people in Montgomery County thought, oh, we got this, you know, we don't need to involve ourselves with that. But some members of the Commission on Aging saw it differently and definitely pushed county government and leaders to join with AARP's network and to do what it would take to become part of that network officially. And so what that requires is getting buy-in from the executive branch and the legislative branch. So for us, it was the county executive and the county council. So they had to officially say, we want to engage in this process. And then we embarked on the first community-wide needs assessment of people who are 55 and over. So we did that. We had surveys, and we had over 2,000 people who participated in that, plus participants in focus groups, a few hundred. And based on the results of that assessment, we created this strategic plan, which I have a few copies here if anyone is interested. So we've talked about the domains, and age-friendly AARP's model is roughly 8. Montgomery County decided to have 10 domains, so we added employment as its own domain, and also we have safety that might be a little bit different as a distinct domain, and then elder abuse prevention. So those are particularly important. You know, sometimes these categories overlap. Safety, people have battled about, well, where should financial exploitation and prevention of fraud fall? And it could be safety, and it could be certainly elder abuse prevention. That's just a small example. But we have been really pleased to participate with Age Friendly because we have been able to participate in these webinars and get ideas from other communities about things we could do. And when a number of years in, and the administration had changed, and leadership in our department had changed, and Commission on Aging had changed, and we really had to say we're not in the same place as we were in 2015. Where do we go from here? AARP's age-friendly manager participated with us and our leadership team and kind of helped us, work through that. And they have been welcome every time that they've been invited to participate. They've accepted. So it's really neat when people can say, oh, well, you should talk to this person, you should talk to this person, and it doesn't matter where in the country they are, we can connect with them. So I wanted to share just a few of the things that we've done fairly recently that we would consider successes. So one of our very ambitious members of our age-friendly network works for our county's technology and enterprise system department, and she runs something called Montgomery Connects. And so, of course, during the COVID emergency, the need for people to have access to computers and tech just got so heightened. So she and her department very aggressively sought federal and state grant money. And they were able to provide 170,000 free Chromebooks type of laptop computer to county residents. And in working with our department, specifically reached 19,000 older adults. But as you know, it's not enough to just provide a device. You need to train people, and you need to have ongoing support available, and you need broadband. So a lot of these funds went for all of these things, but thousands of people, almost 5,000 older adults received training. And some of these folks, hundreds, did weeks-long training. It's very intimidating to many older adults, but with patience and a commitment over time, people realized they were capable. And AARP has an affiliate called OATS, Older Adult Technology Services, I think, and something called Senior Planet, which provides ongoing training to older adults on how to use tech. And it could be a computer, it could be a cell phone, it could be for things that are work-related, it could be for fun, social networking, photography, etc. And so the fact that more and more people were getting comfortable with technology was so crucial to addressing their isolation during COVID. And then there are programs like exercise and other things like that, that now they can access even if there's a problem with transportation, which we're always trying to chip away at that. One of the other things that we've been very fortunate to lead on really nationally is the development of what are called aging in place villages, which are very kind of micro organizations. They could be focused on something as small as a neighborhood with maybe 1,000 people, or it could be multiple zip codes. So that could be thousands and thousands of people. And this started, right around 2005. There were a number of groups. It was inspired by Beacon Hill Village in Boston. But the commissioners in Montgomery County did really grab a hold of it and say, we've got to have these. It's very difficult for a government to create villages, but we found we can support them. So where leaders decide they want to work with each other, a handful of friends, to create a small organization in their neighborhood that could provide social activities, rides to doctor's appointments, help changing light bulb, help with computers, whatever it might be, they started forming. And we have over 30 of these organizations that exist in our county. And what the county did to support that was hire a full-time person to coordinate and to support, provide technical assistance to these groups, and also to provide some seed money. So sort of like a challenge grant kind of concept. They don't need a lot of money in many cases, but they need some. And just removing some of the burden related to things like paying for your internet or your website, things like that. So that's been something that the county's been good at supporting. And then employment, I just want to make sure I talk about employment because people are going to need to live longer if they're going to live well and stay engaged. So for many years, decades really, there's been something called the 50 Plus Employment Expo. And traditionally, it was a one-time event. So we'd gather employers and you'd get people to review resumes and you'd have some lectures on things like transitioning. And it was one day though. So if it was really bad weather or who knows what could happen, you were throwing a lot into one day. Well, then COVID came along. We in the middle of planning that one day event, and obviously it wasn't going to happen. It was in May of 2020. So the shift occurred then, and it has maintained that now instead of a one-day event, we have about 6 throughout the course of the year. And it's less of a burden for employers now, and there are many more people who can participate as attendees. So again, there'll be lectures on how to use LinkedIn or how to engage in a job hunt. And then in the afternoon of these virtual expos, employers who have jobs right now will present on their organization and tell people what positions are open and how to go about applying for them. And they often share their contact information. There's Q&A. So that is thanks to, yes, some county government money, but also the nonprofit organization in our community, probably the largest that's focused on older adults. So those are some of the ideas I had, but I wanted to make sure that my colleagues had a chance. There were some things that I missed.
Sure. Thank you, Sean. Good afternoon again, distinguished guests. The only thing that I would add to your presentation is that Montgomery County is one of 24 counties, actually 2 of 24 counties in the state of Maryland, where we have an integrated health system. We have the Department of Health and Human Services, and many of you may find that with an age-friendly ecosystem, you have the resources of, I've heard mental health, I've heard public health. We also have our services to end and prevent homelessness, as well as those individuals that work in a multi-family, multi-generational system. So these resources are available to help strengthen our ability when we think about strategic initiatives. This complements our age-friendly approach. I'll stop there and turn it over to Dr. McGee, who actually leads our aging and disability services.
Yes, good afternoon, everyone. So the only thing, first of all, Sean, thank you so much for that historic context and the walk through our age-friendly initiative to our distinguished guest. I just would highlight that our age-friendly network is very diverse. We cross several domains in our county, ranging from fire and safety to our libraries. It is a collective initiative countywide that we are always looking to grow. We are always looking to tap into new arenas, new fields, individuals that are not at the table, to bring them at the table. We have currently launched what we call a call to serve. So all of the departments that are not a part of our Age Friendly have not been engaged in some time. We're inviting them to do so. We rotate our leadership. Our current structure is that it is our Age Friendly network is shared between Dr. Bridgers as well as our acting director of the Department of Recreation. So they both co-chair the initiative. There are about 30 departments within Montgomery County government's ecosystem, and we are looking to share the wealth among those 30 offices so that each department will be part of the leadership of our age-friendly initiative. I heard affordable housing. That is something that we are working in collaboration with our Department of Housing and Community Affairs to really solve for some of the challenges around affordable as well as accessible housing. We have several commissions within the department, the service area of aging and disability services that really is focusing on affordable and accessible housing for older adults. So that is something that we also engage our age-friendly network on. The thing that I think is very important to the work of our age-friendly network is that it is a think tank. We come to those meetings with everyone with their particular lens from the positions that they sit in, whether it be nonprofit, county government, and they're really coming to the conversation to really enrich the conversation with a lot of ideas and where to take our age-friendly initiative. So everyone is very dedicated and compassionate about the work of age-friendly and moving it forward into the next decade. So Sean leads that effort. She has re-engineered those network meetings to really be focused on specific goals that we are meeting. And then the last thing I will highlight is that Sean has embarked, because it's been about 10 years since our last community health needs assessment. We just secured a vendor, and Sean is working with that vendor to develop a tool and create a new survey tool that we'll use to disseminate and have our needs assessment updated. So we are looking forward to that initiative to really understand where our older adults are today. By 2040 in Montgomery County, our older adult population is going to be greater than 50%. So we are preparing now for what that looks like moving forward. So I'll stop right there. Thank you.
Thank you very much, colleagues from AARP Montgomery County. It's very nice to see this interaction between the affiliate member and the local strategies that are developed to respond the needs of the population and engaging the different people, the different sectors that can respond to these needs. This is the goal of the age-friendly cities and communities. Thank you so much. Unfortunately, we won't have time for discussion, because I know that the delegation from Brazil has other commitments, but I would like to open the floor to our colleague, Thiago Eric de Sá, who's connected online and oversees the WHO program at the global level. And I am sure that the experiences that we listen here with the Paraná affiliate program, AARP will give light to many more opportunities of sharing and contributions to the global network and the global affiliate members. So Thiago, if you can comment, 2 minutes, that would be great. Thank you.
Thank you, Patty.
Thank you. Give me the chance to speak in Portuguese. It's very seldom that I have this opportunity here in Geneva. So I would like to tell you that I'm a technical responsible for our headquarters in Geneva, and I work very closely with the PAHO colleagues in the region and in the country. And I will be brief, and I will focus on just congratulating and celebrating Paraná State as an affiliate member. We are extremely joyful about that, because we know that in other countries, when cities and communities have the support of a sub-regional program, they express a commitment from the cities and the communities so that they become friendlier with, they become age-friendly. Then with all the programs and like the programs that the government and Dr. Leandra has pointed out are expression of the state of Paraná moving forward with a lot of success. And there are others like AARP and Montgomery County who are part of a global network. And you can rely on our support from WHO, from PAHO, and all of this network that we have. And this is the beauty of a global network. It is this platform that connects people, cities, states, and countries so that they can use it as inspiration and show what done for each area of work. And we have seen so many inspirational programs. Dr. Maria talked about their diversity and the beauty of their diversity. What we see at state level, at country level, international level, network has more than 1,700 members from small communities with 200 inhabitants of 20 million inhabitants. And this is the kind of experience that strengthens the state of Paraná, our newest member in the Americas, the first one in Brazil. And first of all, we know that Paraná will be a great partner we can count on as an international leader and as advocates for healthy aging. And I would like to close this brief intervention to bring to your idea that it has been 15 years that our global network met in person the last time. And it's with great joy that I tell you that the third meeting, the third world meeting of age-friendly cities and communities is going to take place in San Sebastian in Spain. And of course, WHO and PAHO would like to count on you from Paraná, all the cities and the municipalities and Montgomery County, AARP. And I would like to again congratulate everyone for everything that has been achieved. And I would like to thank the presence of our colleagues here. Thank you very much, Thiago. As I have said, we won't have time for questions and answers, but we know that the examples we brought forth here have created opportunities and opportunities for exchange and discussions. And here in from PAHO, Brazil, with my friend next to me, we can promote these discussions so that they can be carried on the scope of the global network. And thank you very much. And to wrap this up, I would like to give the floor to Dr. Christian Morales so that he can close the session. Thank you very much, Patricia. In order to close the session, I would like to thank
in Montgomery County, to thank also our AD, Dr. Rhonda Thomas, James, for all the support, Sonja, Patricia, and Maria Cristina from my team. Y mais uma vez, parabenizar também.
And I would like to congratulate the team from Paraná and the leadership of Governor Massa in this area, being an example, as we have seen this morning. But I would also like to close by reminding everyone once again that we have to bear in mind our dear Enrique Vega, who worked with us for such a long time to make sure that we're here today. He didn't work alone. He worked as a team with our dear Socorro Gross, who represented OPAS in Brazil before me, Secretaria Leandre also, so that we are able to get to this very moment where we can consider broader policies so to meet the need of the elderly. And I think this helps us consider the future, knowing how to work and how to consider partnerships with Paraná, with the governor, to continue to work with the definition of a cooperation agreement where we can include issues like management, governance, considering the triple frontier with Paraguay, with Argentina, and the issue for health surveillance and the care network, the cross-sectional networks for our age-friendly cities and communities programs, the public healthcare agencies, and the use of the strategic funds as a tool for the inhabitants of the state of Paraná to have access to medication and have a better access to healthcare, such as the introduction of remote healthcare, AI, and other topics that are being discussed as the director and the governor pointed out to you. So with nothing else to say, I would like to wish you a good return back home, and I hope everything is very productive. Thank you very much.
Muito obrigada.
I would like to invite everyone to join us for an official photo and wrap up this activity. Thank you very much.